Welcome to another episode of Fueling Conversations, a sport nutrition education network podcast with Dr. James Fleming. Today we're diving into a crucial yet often overlooked topic, pelvic health. Joining me is Emma Brockwell, a leading pelvic health physiotherapist who's on a mission to break the stigma and raise awareness about the importance of pelvic floor function in sports and everyday life. In this episode, Emma unpacks what pelvic health physiotherapy really is. It's focused on the bladder, bowel, reproductive organs and musculoskeletal structures and why it matters for performance, recovery and overall well-being. She shares her personal journey into the field, shaped by her own experiences during pregnancy and postpartum, and highlights the urgent need for better research, proactive screening and multidisciplinary support for women in sport, particularly around pregnancy and returning to play. It's a conversation that challenges taboos, educates and empowers. Let's get into it. Hi Emma, do you mind, this is always the awkward bit, do you mind kind of introducing yourself and let everyone know kind of what you do briefly, and then we'll get into kind of your career, what you're currently up to and those sorts of bits.
Yeah, well, thank you for having me on your amazing podcast today, which probably for the past year I've said I've been on, or for however long it's been going, but I'm not the easiest to pin down because I'm very disorganized. So I apologize. But basically, I'm a pelvic health physiotherapist. And maybe we'll delve more into that in a moment. I have a clinic in Surrey where I live, which is my bread and butter, but I also have a real interest and passion in the application of pelvic health for the female athletes. So my passion area, if you like, is working with female footballers. But I also am really lucky to work with netballers and runners. And that, I would say, has been something I've gone into more over the past three years or so. And I have a little tiny bit of work, I guess, I've done in the academic world as well, which perhaps we'll touch on. But I'm not an academic. I'm very much a clinician who just takes some of that research into the clinical space. So it's exciting.
We've got a unicorn here, guys. We've got a unicorn. So Emma, do you mind just, again, I remember when we met when we were at Harlequins, and I remember them saying, I've got a pelvic health physio, and I was like, cool, what's that? So do you mind explaining to people what that actually kind of entails? And then we'll probably go into the nitty-gritty in a bit.
Yeah. So you wouldn't be alone if you didn't know what on earth a pelvic health physio is. I don't think most people know. I certainly don't think a lot of people in medicine and the healthcare profession or the fitness profession know. Essentially, I'm a musculoskeletal physio, like any other physio that you'd meet in the sporting environment or clinical environment, but I have a special interest in pelvic health. So that effectively is the optimization of health of the bladder, the bowel, the reproductive organs, and how everything, all the structures that are living above, within, and below the pelvis contribute to the health of those organs, but also how those organs contribute to the musculoskeletal health of everything in and around the pelvis. And I guess the two disciplines that it falls within are obstetrics and gynecology. But now we're taking pelvic health into the sports medicine world because it's an area that is just part of the body. We don't really learn much about it in our schools, in our colleges. We certainly don't learn about it very much at university. Which is kind of mind-blowing, really, when you think it's the middle part of the body and we've kind of lost it somewhere along the line. You don't see it much in textbooks, or the structures, which specifically include the pelvic floor. And that is a huge problem, in my opinion, because pelvic floor dysfunction, which is ultimately when the pelvic floor and all the connective tissue that surround it aren't working optimally, pelvic floor dysfunction can have a huge impact on any girl, woman, man or boy. So it's a key part of our health to ensure that we are physically and mentally well. So it's kind of mad that it's only really now in 2025 that we're still telling people what pelvic health is. And what I didn't add is that pelvic health physios are obviously a physio that would just really explore that area. So we're a little bit of an unknown, but I think over the next year or two, you'll hear more and more about us, because we're starting to creep into every little crevice that we can.
And how have you managed to kind of get into this space, and how are we? Why has it taken so long for us to hear about it? Do you think anecdotally, is it because people might feel embarrassed, or yeah, can you kind of share some of those insights?
Yeah, I think you've probably hit the nail on the head somewhat. Pelvic floor dysfunction typically impacts women more than men, and there is our first problem. We perhaps haven't done enough research within female health. Certainly, if we think on the sports side of things, but needs to have a wee and not quite make it to the toilet. Even fecal incontinence, fecal urgency, not being able to control your bowel motions is incredibly anxiety inducing and embarrassing, even though it shouldn't be. And then beyond that, we're thinking pelvic organ prolapse, where perhaps the bladder, the bowel, or the uterus are falling in towards the vagina, pelvic pain, all conditions that might impact that, like endometriosis and fibroids. We don't really talk about still, do we? It takes women up to 10 years to get a diagnosis of endometriosis. So if women are taking that long to get diagnosis of these key gynecological issues, we haven't even thought about their pelvic health on top of that. So I just don't think these symptoms are discussed enough. And we need to really break down those taboos, really break down those stigmas. And we as healthcare professionals, medical professionals, are really well suited to really start those conversations and keep the conversation going. But I think fundamentally it comes down to education, and that's ultimately why we haven't really delved into this until really the past sort of, I'd say 10 years or so, really is where we started to peel back the layers more so than ever.
And in terms of, we'll probably move into some of the day-to-day stuff a little bit more, but I know you wrote a book, and you mentioned about sort of not being an academic, but doing some bits. Can you just let us know kind of what that is? And then what I'll do is I'll put in the thread some of the links to these so that we can get the viewers to have access to them.
Yeah, so my journey into pelvic health was elongated, shall we say. So I, for about 7 or 8 years, was a musculoskeletal physio. And if I'm honest, I think I burnt out. I just felt exhausted by the back-to-back treadmill of patients. I wasn't hugely enthused by it. And then I got pregnant with my first baby, and I'd already explored pelvic health on a placement, and actually had been really interested about pelvic health, but the mentor supervisor I was working with wasn't hugely enthusiastic about me furthering my journey at that time. I would have been in my early 20s. And it was kind of, pelvic health was promoted as a job you do once you've had kids and you want to just work part-time. But it's not that, just to be clear. And so it wasn't something that was very much encouraged that I continue. So I went into MSK physio and enjoyed it, but was burning out, then fell pregnant. And during my pregnancy, I was really, really, really unwell. I had hyperemesis, which is essentially like awful sickness and nausea. I was vomiting about 20 times a day. I was, prior to that, a really keen runner, and I'd had this image of being a pregnant woman running throughout her pregnancy. I pretty much spent the whole time in bed because I was so poorly. And all of that vomiting, all that pressure on my pelvic floor then caused some pelvic floor issues for myself postpartum. And when these symptoms of urinary leakage and actually severe low back pain were happening, I just thought, oh my God, what do I do with this? And I spoke to a friend of mine who's an amazing pelvic health physio, and she said, come and see me and I'll help you. And as she was assessing and treating me, I suddenly had this light bulb moment of thinking, this is so fascinating. Why isn't every woman after baby or during pregnancy seeing a pelvic health physio? And why, as a physio, am I only found really, really exploring this now? And then you start peeling back the layers and realizing there's no research in the area. There's no guidance as to how to return to running, which is what I wanted to do. And so I just thought, I've got nothing to lose here. I'm not an academic, and I'm really not an academic. But someone needs to do something. Someone needs to write something. So I was really lucky, and through Instagram met a friend, Gráinne Donnelly, who is an amazing clinician and now doing her PhD, an amazing academic. And the two of us, with Tom Goom, who is a running physio, put together some return to run postnatal guidelines. And it was just a white paper. It wasn't academic, But somehow or other, I think we just, with the right time, the right place, it snowballed. And all of a sudden, people started to really be interested in exploring, hell, why are we're letting women put up with pelvic floor dysfunction? Why aren't we guiding women back to running after having a baby? It's just like having any other sports injury. Why aren't we helping and supporting women? And as a result of that, I started to really knock on the door of some amazing academics and say, may I just ask some questions and could you just help me answer them? Because I have a lot of questions, I just don't know how to get the answers through research. So I then really got lucky and started to work with Dr. Margie Davenport and Dr. Sinead Dufour and other amazing academics. Forgive me for not remembering all of their names right here, right now. And they are leading the way in the specialism of exercise during and after pregnancy. And that's kind of my real other passion area, not just working around pelvic health and female athletes, but working around the research questions around the perinatal population and exercise.
That seems to be driving having quite driving quite a lot of change at the moment, with some good movement in terms of postnatal support in professional sport. I know some clubs have just introduced kind of year-long extended contracts and a bit more, it seems crazy, but a bit more kind of protection to these individuals.
It's amazing. It's amazing. I think we're now realizing that actually having a baby could be a superpower for your return to sport. And women up until very recently were thinking, right, okay, I'm going to get pregnant, and that's it.
Retire.
Done. Yeah. My athletic career, my sporting career is over. Couldn't be further from the truth, and it's just eye-wateringly upsetting that 2025 we're still having conversations about women quitting sport because they've become a mum. You do not at all need to quit sport if you are pregnant or if you are a mother. And we as healthcare professionals, medical professionals, should very much be supporting that. And we know that we can. And we only know we can because we're starting to get more and more research into the area. We're starting to say less no and more yes, because now we're getting some answers. So it's incredible. It's an amazing space to be involved in.
It does seem like that from someone looking outside in, that we're seeing kind of more case studies and positive stories that are being shared, which is mad, 2025, and we're having this message. Because I just think, even psychologically, to be at the best of your game, if you're thinking, even if you're just thinking, I want to have a child, what does that do to your performance edge? If you're thinking, well, I now need to think ahead for the next 3, 4, 5 years, does that mean we're actually unable to give 100% because we're not fully in? And we know with the development of female sport, you have to be, or any sport you have to be. So yeah, it's really nice to see. But I guess, like you say, there's massive space for growth here.
Yeah, I think we need more research. I think women need more support financially if they're going to do that. Clubs need more support, or the sports need more support to be able to finance women going through maternity leave, going through their rehab. But we've seen it, I'd say, very much in the field of athletics. You've got the likes of Alison Felix smashing it out the park with her return to run. But then you've also got lots and lots of women footballers now, like Melanie Leupolz. Oh goodness, Alex. Oh my God, I forgot her name. Terrible. Alex Morgan.
Yeah.
Oh, I had a moment there. Alex Morgan. These women are trailblazers, and they're getting back to their sport better than ever before. So I think that's really inspiring. And I do actually think what it shows other younger athletes is that it can be done. It doesn't need to be such a barrier. And it's just another chapter in their career. It's not a big fat the end, which is exciting.
Is there anywhere in particular we could push kind of practitioners or those interested in this area too, in terms of current research position stands or people? I mean, you don't have to remember off the top of your head, because I'm just thinking there'll be lots of people that will experience those that are going to have a child and will not have a clue what to do, and they might not be as fortunate to have a pelvic health specialist, a postpartum specialist in other areas as well. So is there anything you can kind of push them, like direct people towards?
Yeah, I mean, the narrative very much now is that if you have a low risk pregnancy and the doctors have said that they're happy for you to exercise during pregnancy, that the risks are way, way, way outrun by the benefits. The benefits are massive about around exercise during pregnancy. And the guidance, there is guidance out there. I would suggest if you're interested in the space, go to like the Active Pregnancy Foundation. That's a great website that's full of a lot of the research that we've carried out, that offers lots of guidance for clinicians, but also for pregnant and postpartum women. I'm currently working with FIFA, creating an education hub, which very much will detail all of this, the incredible research that's out there. And it's very much written for coaches, for medical healthcare professionals, but also for the player as well. And that I'm hoping, I think the plan is for that to be out in March. So that would be a really useful tool, and it's free to access.
Do you guys like actively think about how you disseminate that information? Because I always think sometimes that although it might be written for the coaches, how do we get it to the coaches? How do
Yeah.
we, is there like little video clips or anything coming, or is it just
Yeah. So I think the ultimate plan is to have an app. It'll be a website,
nice,
videos,
lovely?
everything you ebooks, everything you can think of. I think FIFA are going to try and cover it.
Yeah, lovely.
It's just been a bigger project, I think, than
Yeah, of
they
course, it's huge, isn't it?
before, and
Like you
it's
say,
taken ages.
where we're at.
Yeah. But a lot of them normalize it. They're like, well, it's just part of being an athlete. This is what happens to us all. And we just pop a pad in and put up with it. And it's just so annoying that they're padding up and putting up because they don't realize that actually you can do that for sure, but you can actually improve, maybe even resolve those symptoms. So it's having that education in place to actually say, look, someone like myself exists and I would like to help you. And then integrating it into their training program, a bit like we did at Quinn's, really.
Yeah.
We're not saying it's another thing to add in. We're just saying, right, if we sprinkle a little bit of this in with what you're already doing, and it will take time, but we can probably resolve your symptoms really easily. And certainly physically, you'll feel better. A lot of the girls worry about if they wet themselves, the look it will have on their shorts, if it's leaking through onto their shorts. So mentally, it's going to make them feel a lot happier. We certainly saw this at Quinn's, that a lot of the girls will reduce how much they drink in a bid to not leak, which is actually counterintuitive. And actually, then we can get them hydrating more effectively. So therefore, their performance improves.
Yeah.
And beyond that, we're seeing, certainly in rugby, because there's more research in that the effects of pelvic floor dysfunction really negatively impact performance with rugby players in particular. And so if we can resolve those issues, we're not just talking an improvement of physical, mental health, we're talking an improvement on performance, which is the real big thing for athletes, right? That's what they care about. I want to be better. How can I be better? Well, let's just pop that piece of the jigsaw puzzle in and see if that helps. But I think beyond that, what else we're exploring in football is what impact improving pelvic health might have on long-standing low back pain, hip pain, groin pain. And this is the thing, this is why I bring it back to, it's just another musculoskeletal condition. And if we can improve pelvic health, that might then reduce the amount of symptoms of pain that you're experiencing throughout the month or the year. And again, that's then going to help you play better. So it's just about drawing all connecting all the dots really. And I think we're seeing some really good results.
I guess, yeah, thanks for sharing. I think it's fascinating. I kind of dipped into different areas there, but one of the things I was going to talk about, the psychological element in terms of feeling better, that kind of thing. And obviously, I've experienced it because we met at Quinn's, and we'll talk about probably the hydration thing we did and how that really aligned and was a real simple win. But when you go into these places and they say, okay, we've got Emma Brockwell here, pelvic health specialist, she does this, and then you say, this is what a consult looks like. That must feel like quite a daunting prospect for females that maybe like, hang on a minute, I don't know who you are, and you're going to come in and start looking at me, or whatever else might be. So how, because obviously a big part of your role, for those that don't know, is to get in and do the education piece like you mentioned. How do you navigate that?
Yeah, that's been a real kind of learn for me, to be honest. So just to give you some context, when someone comes into clinic to see me for pelvic floor dysfunction, they're paying to see me, they want to resolve their symptoms. And typically one key part of the assessment is a vaginal examination, which doesn't hurt, but it is a digital examination of someone's vagina that you've not met before. It's quite an intimate assessment. And I'd say women coming to see me are aware that that's probably likely to happen. They don't have to have that. You have to consent, obviously, but they don't have to have that. But it's incredibly helpful for me to really feel how their pelvic floor is working or not. When it comes to sport, a lot of the clubs are asking me to come to the space. The players aren't, okay? So I have to be really respectful of that. I always have to be respectful of the fact that a lot of these girls are a lot younger than the typical population I would see. And a lot of them wouldn't have even had a smear test yet. And I think once you've had a smear, you have a bit of a better idea as to what to expect with a vaginal examination. My vaginal examination isn't as potentially uncomfortable as using a speculum because I don't use that. But it isn't very pleasant. That's not fair. It's not very for some women it's a little uncomfortable and embarrassing, but it doesn't have to be, just to be clear. And so I've had to learn how to assess pelvic health without doing vaginal examinations. I have to do a lot more external examinations. Remember, we just have to bring back in our MSK assessments, looking at how the pelvis is moving, the hips are moving, have a palpation of the pelvic floor externally, which is very, very different and much less invasive. And that's how I get them on board. It's only the very few that we are just not resolving their symptoms where I have to think maybe we should explore this. But by that point, they'll know me and feel more comfortable. And the other thing we can look at using is using ultrasound. I don't do that because I don't have an ultrasound machine, but we can very much use ultrasound to look at the pelvic floor, which can be helpful as well. So in short, there are lots of ways of assessing the pelvic floor beyond the vaginal examination. And that's the first thing I say in my education talk. If you want to see me, you don't have to have a vaginal examination. It's all right. I'm just going to look at you as any other physio would look at you. And I think that's a good
and it seems to be a consistent thread here that it's just another thing. It's just another thing we need to try and stay on top of if we want to be healthy and ultimately optimize our performance and well-being. So I think the minute they know that that's what you're there to do, then hopefully it kind of trickles. But this is like everything, right? Like we saw at Quinn's, you kind of need time. You need to be there. You need to build that rapport and trust, because you coming in here and there can be quite a challenge, right? And I suppose that's where we're at in infancy in this space, as well as the space that I'm in too.
Yeah, that's the biggest issue. It's money to get us in regularly. I do think they need to see our faces regularly to trust us. They also need to see that things are improving, and I need to be there to improve things. And I do think time is the big thing. And there's no quick fix to these issues. And so it's giving us that time to make the change. And I think also all of us being on board, I need to know what you're doing, you need to know what I'm doing, and I need to work collaboratively with you, like we did at Quinn's. We're talking about hydration, and you need to be messaging the same message that I'm messaging. Otherwise it's an absolute waste of time. So it's about taking us out of our silos and making us work collaboratively.
And that's why I was so keen to get you on board. For obviously you're impressive on many fronts, but it was about can we share? Because it's nowhere near my specialism. But when you came in and I was like, I don't know what a pelvic health specialist is. I think you were going to talk about like the hip. And I was like, okay, fine. Like, so can we go about hip injuries? And then we spoke and I was like, okay, how does it work? And you just said to me quite simply, James, if they're dehydrated, that can be a real big relation to, I think it was pelvic incontinence. So we did a simple test, not my favorite test of doing a urine analysis for loads of women. But we did see a massive correlation. Like 70% of those that were dehydrated also had pelvic incontinence. So, that is objective data. It's quite powerful. I mean, I don't think it had the impact that we'd have probably liked, due to probably not being in as much as we'd like, if we're being completely transparent. But if that's stuff that hopefully those that are in sports nutrition or S&C can go, well, how can I work with this specialist? And it only happened because we had chats, right? While we were waiting for consults or while we were having a coffee. And it's super important. I guess just another thing that sprung to mind before we move on to, I suppose, a bit more into that WSL space. In terms of time, because I know everyone in professional sports seems to be time poor, even though there's a million meetings a day. And that is a dig. Yeah, that's
very important.
Very important because everyone must be there. But how much time do you think, is needed per day, per week to sprinkle on top in terms of to have an improvement or to have a positive change, I guess?
Yeah. I hope I'm not doing my profession a disservice by saying that I think at the moment, the way things stand, I don't think someone like myself is needed full time in in one club, which is very cool because it means that I can spread myself across a whole heap of clubs. I think in an ideal world, I'd be in once a week. Ideal. Okay. At Chelsea at the moment, who are probably the most progressive, along with Arsenal in this field, I'm in twice a month. And that works because I've got an amazing physio in each club banging my drum whilst I'm not there and developing the exercises if I'm not there. And I've got strength and conditioning coaches who are integrating what I've given them into the planning, into the programming. Without that, I'd need to be there more for sure. So that's why I'm saying once a week is ideal, because then Ali and Emma haven't got to keep banging my drum because they've got a gazillion other things going on. Is the funding there yet for that? Sadly not, but can we make a case for it? 100%. And we need to find the money. You know, respectfully, football has a lot of money. This is why I think we're making some inroads with pelvic health in football, because there's money there. Rugby, there's no money. So I understand why it was harder to establish, but I know that people are hell-bent on making it happen, and from a pelvic health, nutrition, menstrual cycle point of view. But they're behind because they haven't got the finances. Football has the finances, and we owe it to women, because we definitely know that women who leak when they're young, even if it resolves perhaps because they retire, it will be likely that they'll experience pelvic floor dysfunction later in life. And pelvic floor dysfunction is one of the main reasons women of a much older age are admitted into a nursing home, because they are wetting themselves. They might then fall as they dash to the toilet, fracture their hip. So
Well, that's like a light bulb moment there. Sorry, because my nan,
yeah.
exactly that. My nan sadly passed away relatively recently, but she again was unable to get off the chair. And then because she had pelvic incontinence, yeah, that's a bit of a interesting one.
Maddening.
Yeah,
It's maddening. And we also know that women with hip dysfunction, there's a very strong correlation between them and pelvic floor dysfunction. So, you know, we have to think more long term with this. And I know it's very easy for me to go into a club and say, hey guys, you might be leaking now and it might get a bit better, but you know, when you're older, and they're like, feels
worry
like
about that
forever
then.
away.
Yeah,
I know it's not forever away because I was also that age once, and it still feels like I'm 21, even though I'm not. And so you just have to keep banging the drum. And it's the same in nutrition, right? If they get
yeah,
the nutrition right young, oh my God, what health gains do they make in their future
yeah,
life?
yeah, yeah.
But you need the people at the top to see this as well and
Kind
hear.
of holistic viewing, isn't it? It's holistic viewing, which we're kind of getting there. And it depends. Sometimes it kind of depends who's in the space, and often driven by money. But it's interesting again how it comes down to we're getting well-being first. We're getting the fundamentals right, which will then have a massive knock-on effect on all of those nuanced kind of training behaviors, psychological elements, and also the long-term aspect of, yeah, at the moment, everything in your tunnel is Chelsea Football Club.
Yep.
And I get that that's what football is. That's what sport is. Try to be in
You're
that bubble, but
consuming.
actually just open up a little bit to be able
Yeah.
to say this is going to have a huge effect long term and on all other aspects too. I
Yeah.
think yeah, I think it's really, really interesting. I guess
But
go on.
no, sorry, I was just going to also say one of the reasons we lose girls to sport is because of pelvic floor dysfunction. So girls don't want to wet themselves in front of their mates. I understand it.
Makes sense.
If that was happening to my daughter, I know for a fact she wouldn't want to carry on running or playing football. So we owe it to women, girls, to just ensure that, if we want a more active population, we need to be getting in there. If we want girls and women to be eating well, and by the way, Reds is a massive, massive risk factor for pelvic floor dysfunction. So if we can improve what they're eating, that's also going to help their pelvic floor as well. It's just a bit of a no-brainer
Yeah.
to me, but it seems a lot harder to get in there than it should be.
And excuse my ignorance, but kind of biology at school, or I don't remember massively going into this space at all. We know about the main systems, the main organs, but I'm just thinking because my wife's a PE teacher, like 14, 15 seems to be dropout age. And often we associate it purely with social media and sexualization, whatever else, whatever is quite easy, soft, easy way to do that. How do we get into schools? Is that on your to-do list?
Oh, that'd be nice. No, actually, there is now, I believe, some policies in place that should be bringing pelvic health into education
Nice.
from puberty. That's really where we want to get in.
Yeah, of course.
And actually, my stepdaughter, she's 15, and she did say to me last year, she went, "Oh, we had some talks on pelvic floor and what it does and what it looks like. You know, most women don't even know what it looks like."
Yeah.
And I said, "Oh, and what did you make of it?" And she's like, "Yeah, actually, it was really good because it helped us understand that if you're leaking urine, there's something you can do about it." She went, "To be honest, I don't think any of my friends do leak urine." She's in a netball team, 100% urine, because about 1 in 3 girls who play netball do leak urine. But even if they don't want to share that with their friends, fair enough.
Yeah.
But they know then that they could potentially go to the doctor and just say, "May I please see a pelvic health physio?" And the doctor should 100% say, "Of course, yeah, let me refer you. Yes, the waiting list long, stay on the list because it's well worth seeing a pelvic health physio,
I
or
love
go
that.
and see someone privately."
Because like you say, you're getting it at the roots, aren't you? Like
Yeah.
that's got to be the starting point. And in terms of, like you say, go to GP, refer, there will be a waiting list, but there are plenty of pelvic health specialists that will be available, or not so much that
No,
last point.
no, there's not so many. I think there's about 900 of us in the country.
Okay.
Uh, so unfortunately, the lists are long, but we are good at what we do.
Yeah, yeah,
So I
yeah.
think it's just a case of waiting, even if it's 3 or 4 months. Probably, unfortunately, a lot of these girls have been leaking urine for quite some time. So I'm hopeful that that would be not too long to wait. But they can start doing pelvic floor exercises. They can download the Squeezy app from the NHS website. It's about 2.99. It's not, it's not going to help everyone, and that doesn't mean that we can't resolve symptoms, but it's just worth being aware that it might be that you need other things other than pelvic floor exercises. Trying to resolve constipation, drink more. Constipation is a big driver of pelvic floor dysfunction. So just those little things
Yeah.
that you can try and do. But if you go onto the NHS website, onto Squeezy, that will certainly give you some good
Just writing that down. I'll make
advice.
sure we put that in the notes when I work out how to use YouTube. But just conscious of your time and moving forward. So I guess we'll do some quick fire. I'm going to kind of have a new idea for this podcast. That was the plan. And but if in terms of those aspiring kind of athletes and practitioners, because I just remember, and I don't mind sharing this, but I remember obviously we get on quite well.
Yeah,
And I used to go into the physio room quite regularly to do body composition assessments or just one-to-ones. And then
yeah.
I saw a note on the door saying consult happening, and I just knocked on the door. And I've never been so embarrassed in my life when you came to the door and said, "I'm just doing an assessment." And I was like, "Okay, I see you." But it was one of those situations where obviously we got on and it was a bit of a joke, and obviously I kind of probably sensationalized it a little bit. But is there anything for yeah, notes for any practitioners, whether that's S&Cs, psychs, coaches, parents, what would be the kind of overriding message you'd give them to make some inroads here?
I think the big one is screening. If you work with female athletes, don't be afraid to screen and ask the questions. I know it's difficult, more difficult for men, potentially, because you are talking about things that you might not feel so comfortable about. But there's there's a lot of screening tools in development. I would again pop this, if you pop this in your notes. It's the PFD Sentinel. It's a six what?
6 point question, six questions
Six point,
questionnaire.
yeah, whatever. See, now I'm 45 and perimenopause, so I can't find that. But it's just 6 questions ultimately. You don't even have to ask. You can just give the player the piece of paper and just say, "Look, if any of these symptoms are affecting you, just tick them." And then you can start saying, "Okay, nothing to worry about. However, it would be wonderful to get this sorted, I
Yeah.
think. Would you agree? Yes, please." And then you can say, "Great, then let's have a chat with your GP or the doc in club, and let's see if we can get the ball rolling." So I think screening, asking the questions, the more you ask, the less weird and uncomfortable it gets. And I come back to education again, just all of us having the conversation. If you hear or see one of the girls doing pogos and she says, "Oh no, I've just wet myself," and laughs it off, just say, "Oh, that's okay." Do you know how many of
Yeah,
the
yeah.
girls probably here do that? But you do know there's something you can do about that, don't you? It's just taking advantage of those little opportunities, And then all of a sudden, everyone in the club, in the team thinks, oh, I don't feel so embarrassed about talking about this now because we're having a normal conversation about it.
100%. And I think that's why, again, as a male practitioner working in a female space, I remember the first time kind of talking about menstrual cycle, and I saying to my students, like, you can't avoid it. It makes you get much more respect by actually asking the questions than by you trying to shy away from it, because these people want to know you care. And if you
Yeah,
don't talk about these major physiological potential confounding aspects or not, then actually you're doing yourself a disservice and you're doing them a huge disservice. So I
yeah,
think my message out there to male practitioners out there is just to ask the question as well,
yeah,
to seek support, and when you're outside your comfort zone, then of course refer and
yeah,
do that. It's just we have to be on the same team here. It's all about, especially in professional sport, we're always banging on about the same team, one dream, all these cheesy acronyms and whatever else it might be.
yeah,
Nice PowerPoint slides with lions on. But we
yeah,
have to be on the same page, and that is working together, reaching
yeah,
out to people like yourself, utilizing them properly,
yeah.
understanding the value of it, and paying appropriately, because you only, to have an impact is going to be something there as well. And it sounds like we're in a good place with professional female football. I
Yeah.
guess it's just the wider
Oh, it
landscape.
is, and it's getting it to the grassroots. I don't want to glamorize it or make it out as if we're all smashing it out of the park here. We're not. We're really at the infant stages of this, and I really can't emphasize that enough. It's smoke and mirrors, really. We can do better, much better. But I think also just to caveat that men and boys suffer with pelvic floor dysfunction as well. So, if you are a female or a male practitioner, don't forget to ask the guys you're working with as well, because men's health physiotherapists are phenomenal and they are really brilliant at helping manage, erectile dysfunction, urinary incontinence, perineal pain. Lots of triathletes experience that from all that
Yeah,
sitting
of course. Yeah.
on the bikes. There's so much. We've got to be putting the pieces together and thinking holistically, not just in these separate body parts that we seem to do in medicine. But yeah, we need to do better across
And
the
that
board.
was my favorite thing at Quinn's, actually, was being surrounded by, experts like yourself, Amal Hassan, Corinne, and other, and work. When we got together, it
Yeah,
felt, I felt so empowered. I felt so
yeah,
kind of like I was learning. We were all working off
yeah,
each other. And if when you're in that environment, it goes right, you can make
absolutely.
such big changes. And I remember we had a chat with one athlete, and we had myself, Corinne, and Amal in place, and you could just see she was there straight away, like, oh, I don't have to repeat myself 5 times.
Yeah,
These people are all on the same page. They understand we're going to make progress. And some places are better than others. We understand the limitations there, but I think this is the way that things are moving, which is good. Um,
definitely.
Thanks so much. Just going to do a few quick fire questions. Some of these are a bit cheesy. So, a big part of this kind of podcast is to try to educate as well as kind of advise. And one of them
Yeah.
is about career advice. What kind of is the best piece of career advice that you have received, you think, or that you would like to share with others in terms of, you know, making progress? Because a lot of what you're talking about with your books came
Mm.
from networking, and I don't know if that's something that comes naturally to you, or yeah, any advice you could give.
I think follow your gut. I wish I'd followed my gut sooner, and entered pelvic health a lot sooner. Find a good mentor, and don't be frightened to reach out. I am, as I keep saying, I'm not an academic. I don't, I still put academics on this real big pedestal. I'm quite overwhelmed in that space, but what have you got to lose by just knocking on someone's door, dropping them an email? I think if you've got something that you're really passionate about, explore it and don't be afraid to network. Because actually, I think most people in our space are really keen to collaborate and to network. And I think it doesn't matter if you've been qualified 6 months or 6 years, go for it. If you're interested in it, just knock on the door and start conversations with people.
And have it, and kind of being a bit of a hybrid in terms of academia and practice. I think there's often a big disconnect between academia and
Yeah,
practice. And we need people like yourself who are able to do that, because otherwise academic practice stays in academic practice.
yeah, it
And I did
does.
the PhD for what felt like an eternity. And one of the big things is, how do we get that information to the people that will actually
Exactly.
benefit? I'm still asking that question. It's something that I'm really passionate about. And I think, yeah, we need to have that approach. And the last one is apple pie or apple crumble.
Apple crumble.
Good. We can still be
Sorry.
friends. We can still be friends.
Excellent. Love a
Cheers.
bit of crumble.
Thanks for your time, Emma. It's so good. Really, really appreciate it.
Amazing.
I'll make sure we do share all of these resources as well for the listeners. But yeah,
Amazing.
awesome. Thank you so much.